To Panchakarma in arthritis. Today's guest speaker, Dr. Rajini Hegde.
लोके जरारुभयमृत्युनाशं धातारमीशं वेदौषधीनाम् ॐ शान्ति शान्ति शान्तिः.
Now I invite Dr. Priyadashini ma'am, lecturer of Department of Panchakarma, for welcome our guest speaker. I request Dr. Priya ma'am, lecturer of Dept, for welcome our guest speaker. Yes, ma'am.
Hello, am I audible? Okay, thank
Yeah,
you so
ma'am.
much. Okay. Very good afternoon to one and all. Myself, Dr. Priyadashini, Assistant Professor, Department of PG Studies in Panchakarma, GAMC Bangalore. Before I welcome you all for today's session, on behalf of Department of PG Studies in Panchakarma, GAMC Bangalore, I extend my sincere gratitude to Dr. Rajini Hegde for accepting our cordial invitation. Being in Panchakarma fraternity, we all know we have celebrated World Arthritis Day, which was a global awareness raising day on 12th October 2020. So on the occasion of that, we in our hospital, under the guidance of our beloved principal, Dr. Ahalya Sharma, have commenced a medical camp to help, to treat, to create, and to maintain awareness around topics directly concerning people with rheumatic and musculoskeletal diseases in society. To celebrate the same and to create awareness among our PK fraternity, we, under the guidance of our dynamic HOD, Dr. Ananta Desai, decided to organize a webinar on arthritis. For the today's presentation, we felt Dr. Rajini Hegde would be an apt guest speaker who has done her thesis work on osteoarthritis. Her thesis topic was to evaluate the effect of Upanahasveda in Jandusandigatavata with Vachadi and Godhumadi Yoga, what we practice routinely in our department and succeeding tremendously out of this treatment. Before we begin, on behalf of our department, I feel immense pleasure to welcome our beloved principal, Dr. Ahalya Sharma, for this webinar. On my behalf, I welcome our beloved HOD, Dr. Ananta Desai, for today's presentation. On behalf of our institution, I feel so happy to welcome Dr. Rajini Hegde, presenter for today's topic. I also welcome our senior colleagues, Dr. Shaila ma'am, Dr. Santosh Yelledahalli, Dr. Smita, Dr. Ashwini for today's session. I welcome all teaching staffs of our institution and other institutions for this session. It's my immense pleasure to welcome all proud alumni of our department. And last but not the least, I welcome all the PG scholars of our department and other colleges and also UG students of GAMC Bangalore. So the topic for today's presentation would be practical utility of Panchakarma in arthritis. So hope all the participants will be benefited out of it. So without delay, let's begin our session. So over to you, Dr. Rajini Hegde. Please proceed.
Thank you, ma'am. I invite Dr. Rajini ma'am to start the section. Over to you, ma'am.
Okay. Am I audible now?
Yeah. Yeah, ma'am, audible.
Okay. Namaste all. A very good afternoon to one and all present over there. Bowing to the feet of Lord Dhanvantari and Lord Ashwini Devatas. Ragadirogan Satatan Shaktan Sheshakaya Prasitan Sheshan Autsukya Moha Ratidan Jakhana Yo Purva Vaityaya Namostu Tasmai. So let's continue. It's such a pleasure to meet all of you today that after so many years, and it gives me immense pleasure, and I'm grateful to be a part of this webinar, which is a series which is conducted due to the World Arthritis Day, and it's given me an immense pleasure. And this webinar, which is conducted by the Department of Panchakarma, GAMC, which is my college of post-graduation. So this is what make it a special event. So for this lifetime opportunity, first of all, I sincerely thank our principal, Dr. Ahalya Madam, for giving me this immense opportunity to talk in my alumni college. So as an alumni, I'm feeling very proud. So and I also thank beloved HOD Dr. Anand Desai sir and lecturers Dr. Shaila ma'am, who is my guide and well-wisher throughout, and lecturers Assistant Professor Dr. Santosh sir, Huga sir also, and Priyadarshini ma'am, Ashwini ma'am, and Dr. Smita ma'am. So, and all PG scholars have organized this webinar. So, let's go to the topic here. Mobility is a boon to mankind, which also came with the curse of arthritis. You all know that, because without any joints, there will be no mobility in the human beings as well as other beings also. So, with this boon, a curse called arthritis also came to the mankind. This arthritis, what is this? Previously, it was used to people used to call it as old man's disease. So, but it is not like this nowadays. Even though we have reached the heights of scientific research or medical facility or immense heights of technology, the issue of arthritis has remained same. Rather to say, it has become even worse. So, what we have to do? Previously, it is called as old man's disease, but nowadays it is irrespective of ages, it is affecting everybody. So, what may be the cause for this? Is this our environment, or is this our lifestyle, or is this our treatment itself? We don't know. To highlight this, with these in thoughts, let's begin this my topic, that is screen sharing is disabled. Please able. Hello. Am I audible? Please enable the screen sharing option.
Okay, ma'am. Okay, ma'am.
Ah. Please allow me to share my screen.
You can share, ma'am, now.
No. Okay, now I'm sharing my screen here. Is it visible?
Yes.
Yes, ma'am.
Okay. Moving on to the topic, that whatever I said in mind, with this we'll move on to our topic, that is practical utility of Panchakarma in arthritis. Okay. Okay. Just we'll see what are all the objectives of this webinar, what I am presenting today. First one, like approach towards arthritis in day-to-day practice of Ayurveda OPD. This is very important since I have since for me the topic which has been given is a practical approach. So to understand this practical approach, we have to understand the arthritis in the presentation of day-to-day OPD presentation. So this will be our first objective. And the other one is understanding the treatment principles accordingly, that is with special reference to Panchakarma. After understanding how to approach this arthritis in our OPD, after that we have to go for understanding the treatment principles accordingly. Okay, with this said, what I will be dealing is, since we are dealing with the practical understanding of cases here, I feel apt that presenting the case is more apt in this scenario. So I am here presenting you some 4 cases. Presenting is just I will be taking you all for a glimpse of these 4 cases which have been come across in my practice and have been successfully treated. With these 4 cases, we'll try to understand the concepts of arthritis as well as the treatment. Okay, just come to the case 1. See the presentation of the case. It's a male patient who is of 58 years old and his occupation is a farmer and he has no history of diabetes or hypertension. And he came to the OPD with the complaints of knee joint pain since 1 month, which is bilateral. And it was without any show for swelling. On examination, the findings were crepitus present, no visible deformities or any swelling, and the pain worsens during the activities, that is at evening, and it reduces during the rest. And asking about his appetite, it was uncertain. Okay, just keep this in mind. We'll deal with these cases after, like according to that, we'll understand the concept also. So now we are going to the second case. Here is also a male patient who is of 36 years age and he has got no job. That is, he resides in his house itself, and he came with a complaint of severe low back pain, which was radiating to the left leg with numbness and tingling sensation, and it was also associated with the heaviness since 3 months. And pain increases after the rest, that is, and even in the morning and night, that is, in changing posture. And there was no history of fall also, and MRI was suggestive of early spondylosis. And here in his case, it was a normal appetite. Coming to the case 3, what is the presentation of this case? Now this time it was a female patient, aged 45 years and homemaker, complained of pain in the knee joints, that is bilateral, and other joints which show up. On examination, there was no crepitus, tenderness was present, and effusion is also present, that is bilaterally. Pain increases in early morning and patient struggles to get up. And when asked about the appetite in history, there was a reduced appetite in the patient. So this was the case 3 scenario. So next further we will be moving on to the case 4. Okay. Here is the case 4. That is, it was a presentation of a male patient of 40 years who was a businessman, and he came with a complaint of severe pain in elbow and wrist joints, that is bilateral. It was present with the tenderness, swelling, redness is also present, stiffness was also there. And suffering from, when asked about the history, he was suffering from psoriasis since 10 years, and the pain pattern was, it was sudden increase and decrease of pain was observed. So with these cases in the mind, let's start to understand about the concept of the disease. Okay, just keep this in mind, and we will be dealing with these cases and whatever happened in these cases in the further slides. So, exactly what is arthritis? The gross definition of arthritis would be inflammation of joints. We all are well versed with this, and it is accompanied with the pain, swelling, stiffness of joints, etc. And coming to the types of arthritis, there are numerous types of arthritis. You believe it or not, there are actually more than 100 types of arthritis which are prevailing now. Okay, so this is a gross classification of the arthritis. Mainly, you all know that is. It is classified into osteoarthritis, inflammatory arthritis, septic arthritis, or infective arthritis. We can call that. Okay? Osteoarthritis is usually a degenerative condition wherein it is further divided into primary and secondary. I am not going in detail with all these theoretical aspects, okay? Because we all well versed with these theoretical aspects. But the point is how to apply these in our clinical practice. So further, I will be dealing with those practical aspects. Okay, just go through this slide. And inflammatory arthritis is also divided into rheumatoid arthritis, psoriatic arthritis, and crystal-induced arthritis. Okay, and in crystal-induced arthritis, it can be either gout or pseudo-gout. And septic arthritis, and we can also call it as infective arthritis. Infective arthritis is a bit emergency condition wherein there will be a infection to the joint, either it may be due to trauma or during the surgeries, etc. Okay, usually it will be staphylococcus bacterial infection. Other than this, you can also see it as fungal infection or even viral infection. Okay, so here it is arthritis main classification. But as I have said, when we go deep into this, there are innumerable number of arthritis, that is more than 100 types of arthritis. So, okay, this is according to the allopathic modern medicine, the classification of the arthritis. So, coming to the Ayurveda, how to understand these arthritis, okay? When arthritis, when we hear the word arthritis, what exactly comes to our mind? Obviously, sandhis in Ayurveda. So what are all the vyadhis which are associated with sandhis in our Ayurveda? We all know Sandhigata Vata is there, Amavata is there, Vatarakta is there, Dridrasivata, Vishwachi, and more. We all read Vatayadi Chikitsa. In that, our Acharyas has mentioned very beautifully about all the diseases which affect Sangis also. So, all together, what will be there? Maximum 20-25 types. With including the Doshaja Vedas also, we will consider about 25 types. But in modern, more than 100 types of arthritis are present. So how to understand this? Whether we have to name each and every arthritis in the modern to like we have to convert that into Ayurvedic terminologies and we have to treat? No, that is not the condition. See, even though modern has more than 100 types of arthritis, maybe 1000, maybe 10,000, we have to just understand this concept. Then only we can treat and analyze each and every disease. That is, Nanarupai Rasankheyai, Vikarehi Kupitamalaha, Tapayanti Tanum Tasmat, Tat Hetu Akriti Sadhana. Shakyam na ekaikasho vaktum, Atah Samanyam Uchyate. See, this is the wonder of Ayurveda. See, he only tells that Shakyam na ekaikasho vaktum. We can't name or we can't number each and every manifestation of the disease. That is Nana Rupai Rasankhyaye. So, but we can treat those all, even though we don't know the name of the disease, but we can treat the disease. How? Tapayanti tanum tasmat tad hetu akriti sadhanam. See, these three, whatever this is present here, hetu, akriti, sadhanam. In other words, it is Nidana, Lakshana and Chikitsa. These are the three sutra of Chikitsa, very basic principles of Chikitsa. If we know these three aspects, that is Hetu, Akriti and Sadhana, then we can understand any type of disease, whatever may be the new disease. For now, it is 100 types of arthritis, but we don't know. In further ages, maybe 1000, maybe 10,000, but we can't. But in our text, there are only these which have been mentioned. But what he says is Nana Rupai Rasankhyaye Vikarahi Kupitamala. But we can treat all this based upon the Hetu Akriti Sadhana. Am I clear on this? So, by keeping this on mind, how to understand this? Next, we'll move on to a very, very basic practical principles which we have to adopt in our OPD, day-to-day OPD practice. This is very much essential. So now I am going to tell you some 4 to 5 points which we have to keep it in our mind throughout our practicing. First one is, don't treat the disease, treat the patient. Okay? This is a common mistake. What we will do always. We'll go on concentrating on the diseases. That is, okay, this is Sandhigata Vata, okay, this is Amamata, okay, this is Vatarakta. I have to see the Chikitsa principles of Sandhigata Vata, Chikitsa principles of Vatarakta. That I have to know. No, this is not the case. Along with, yes, disease is also important, but along with that, we have to treat the patient. Here comes our speciality. We treat the Rogi, not the Roga. Because Roga may be same, but Rogi is different. Each and every Rogi is different. So, along with the concentration on the disease first, we have to concentrate on the Rogi itself, that is, treat the patient. So, next one is, don't treat according to the patient brought diagnosis. See, this is a very common scenario we come across in our OPD practice. For example, for first instance, here nowadays the patients are so much clever, so much intelligent that they always search whatever the problems are there in the Google. So Dr. Google, okay, they'll search in that and they'll list their diagnosis, and with that list they will come to you. See, doctor, according to my lakshanas, I have got these and these diagnoses. So you just treat this diagnosis. What is the treatment for this diagnosis? I have got osteoarthritis. I have got rheumatoid arthritis. My RH factor is very high. Like this patient will come. So this is the first scenario. Okay. Second one, the patient may go to the other doctors. Okay, other doctors maybe 2 years back or 1 year back or maybe 10 years back. That on that
Ma'am, we are unable to hear you. Ma'am, you are not audible.
Okay, where was I? Yeah. Was to treat according to the patient brought diagnosis. As I have already said, a two cases scenario that once a patient will come and he'll show you the diagnosis of others or his self diagnosis. So what we have to do in that condition? So just we have to treat every case as a fresh case. See, this is what we have to do. Even though we have experience, we know all those things about other like lakshanas and all, but we have to treat every case as our fresh case right from the history taking. Okay, with this, how we can uh, please mute the audio. Okay. After this, first we have to take the history, then report. See, we have all come across these types of situation in our OPDs. The patient will come with their reports in their hand. Before telling you what are all the main complaints he has got, they'll just give you the reports, is it not? So what happens if you read those reports? Okay, the MRI scans, X-ray, blood reports, etc. He'll bring it to you. I'll just quote one case. One patient came with a diagnosis of okay, with all he has tested all the MRIs, etc. Those all have pointed towards osteoarthritis. Okay, with knee joint pain he came osteoarthritis. Okay, but he was only 36 years of age. He came with the reports. Okay, reports also he gave. What happened? Before asking his main complaint, whenever we go through that report, okay, it will create bias in our mind. All the reports are showing towards osteoarthritis, and patient is also presenting with the lakshanas of osteoarthritis. Then we, without knowing, will like to link that osteoarthritis. Okay, it is Sandhigata Vata, same, and we'll just start treating according to Sandhigata Vata. But this is not correct. See, what happens is whatever may be the end results in Sandhigata Vata or any Vataja rogas, what happens? Vata is Kupita. No, Vata has been increased. So, what is the cause for the increase of the Vata doshas? There is actually two types, either by Dhatu Kshayajanya or by Marga Varnajanya. See, even Dhatu Kshayajanya Vata Vyadhi, it end results as Vata Prakopa only, and Marga Varnajanya Nidana also, the end result will be Vata Prakopa. But what we have seen in that case and in that report, only Vata Prakopa Lakshanas we have seen, that report also. But what we have to understand, if we take history first, then we will come to know what may be the Nidana of the dosha. Without knowing the Nidana of the Vyadhi, we can't treat the cases, because Nidana, we have to discontinue the Nidana to go for proper treatment. So this is the one very must and should knowledge what we have to keep it in our mind during the practice. Okay, so next, moving on. See, not only Sthanika but also Sarvadahika Lakshanas also we have to consider. Like I said, arthritis, when it comes to our mind, we always, it goes in hand to hand with sandhis. And even orthopedicians, more, every doctor will go for the imaging, etc. For that sandhis itself. But along with that, Sarvadahika Lakshanas also plays a very important role in understanding that disease as well as treating. For the treatment, Sarvadahika Lakshanas along with the Sthanika Lakshana plays a very important role, because the Sthanika, what is the presentation of the Sthanika, it may be due to Sarvadahika Lakshanas also. No? Due to that, Sthanika may be a secondary symptom. But treating only that secondary disease, we can't achieve any success in our treatments. We have to identify the primary Vyadhi. With that only we can able to achieve to cure the disease. Okay? And how to do that? See, firstly we have to consider in Samprapti Ghatakas Udbhavasthana. Udbhavasthana has got a very important role in understanding as well as treatment of the condition. For example, you all know in Amavata, etc., what is the Udbhavasthana of the disease? It is not directly manifestation into the joint. It is not just a Sthanika Vyadhis. Udbhavasthana is the Ama Udbhava which has occurred in the Amashya. It leads to the further complications, that is, when it lodges into the disease, it will cause the Vyadhi. So, mainly we have to, along with the Vyaktasthana, we also should concentrate about the Udbhavasthana. Okay. With these in mind, like these principles in mind, we'll just continue to the further. Okay. So, after understanding these basic practical principles in OPD, so what is the main aim of Chikitsa here? Being a Vaidya, our main aim is to treat the disease. So, how the treatment should be? Here, there is a very good quote in Sushuddha Sutrasthana 35 that Shuddha Chikitsa, that is, Yat Yudinam Shamayati, Na Anyam Vyadhim Karotisha, Sakriya Natuya Vyadhim Harati Anyam Yudiraye. That is, it's a very beautiful how the Chikitsa should be is described in this quotation. That is, the Chikitsa which doesn't cause any other disease. Okay, It cures the diseases, okay, yeah, but when it causes the other diseases, that is, when it causes anyam vyadhi, then it is not called as a Shuddha Chikitsa or Uttama Chikitsa. When the Chikitsa does the Shamana of the present disease as well as it doesn't do the Udina of other disease, this is called as Shuddha Chikitsa. This we have to keep it in our mind. While treating the diseases, we should not create other complications or we should not create other diseases to the patient. Then only we can practice very successfully. Okay? So, to attain this Uttama Chikitsas, we have to understand about the disease. No? First, coming to the without doshas, there is no disease. So, first we will come to the dosha involvement. How the doshas or their lakshanas, according to that, how we can diagnose the diseases. We all know Samanya Lakshanas of dosha because since from BAMS we have been learning about Vata Prakopa Lakshana, Vata Kshaya, Pitta Prakopa, Kshaya, etc. 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 Whenever the patient comes to us with the presenting symptoms, that is, when the Lakshanas will finally identify, okay, this is Vata, this is Pitta, this is Kapha. But what happens is sometimes it is not as easy as theory. The patient will ask the Tama Satra to like that Vata symptoms only, Pitta symptoms only, Kapha symptoms only. He will not come like that because it's not really theory. This is practical. So when there is a mix of doshas and we are unable, like when it becomes difficult to understand those lakshanas, here is a minute details which we usually miss in our OPD practices. That is, when those dosha vary according to kala. This is very, very important which we miss in our daily practices. That is, Nishante Divasante cha Varshante Vataja Gadaha Pratak Shapado Kapajas Tayor Madhye tu Pittaja. So this goes like this. What it means? That is, according to the Kala, the doshas also vary. We all know that. That is, Vata will increase in Nishante, Divasante, Varshante, even Vayoante, and Jirnante. In Jirna Kala also, during the Anta of Jirna, Vata will increase. And Kapha, Prataha, Chapadaha, and Prathama stage of Vayas, as well as Shleshma, like Bhukta Matra, just Bhukta Matra, just after eating the Kapha increases. So these are the very minute details which you miss. And Pitta, it will be in middle of that. That is Vayo, Anta, so Madhya it will be Pitta Javamis and Jirya Mane. During Jirna Avastha, Pitta will increase. Okay. Here is a little chart for that. See, 24 hours chart. Usually, it is divided into 12-hour day and 12-hour night. In that, 4 hours is attributed. This is a very approximate timings what I have done here for clear understanding. Okay, see, this one is 6 to 10 a.m. what I am showing here. It is Kaphaja symptoms will come. That is Divasa Ante, Divasa Adav, sorry. And this is Dina Madhya, which is 10 to like Dina Madhya afternoon. And 2 to 6 a.m. this is the timing of Vata, that is Divasa Ante. And here, same goes for Ratri also. From like Ratri Adav, it is Kaphaja, and Ratri Madhya, it is Pittaja predominance, and Nisha Ante, it is Vataja predominance. How it will help, we'll deal with our cases later. Okay, we'll see how this helps to identify the disease as well as for the treatment. Okay, after this, okay, you all are curious to know, okay, there will be so many patients in our OPD, how we have to take history, detailed history, and how we have to know all those lakshanas, diagnosis, nidana, samprapti, ghataka, those are all how we should like guess in that short span of time. You know, because OPD practice is not that easy. We don't get hours of time to detect some like Vyadhi, Avastha, something. We don't get enough time. So, here are some points I am giving you about how to, like, not 100% diagnosis, but approximately what we have to ask to the patient to get 70% of the prevalent condition. So, Kala, as I have always mentioned, Kala. So, for example, pain. When the pain comes, this is a very important question. when the pain comes and when it subsides. This is a very important condition, aspect. Sthana of Ruja, it also plays a very important role. Okay? Where whether Sandhis means Adhobhaga or Urdhvabhaga, bilateral, unilateral, this is very important. And Vedana Vishesha, this is so important that it directly gives the hint of the dosha involvement. We all know, that is Daha type of Vedana, Toda type of Vedana, Stabdata, etc. When we ask patient, when patient gives this type of history, so we have to catch that very quickly. And we should not forget Agni. Agni is very important. Even though it is Thanika Vyadi, we have to ask about Agni, whether Abhyavarna as well as Charana. Like ಊಟ ಸರಿಯಾಗಿ ಸೇರುತ್ತಾ, ಎಷ್ಟು ಊಟ ಮಾಡ್ತೀರಾ, ಓಕೆ, ದಟ್ ಇಸ್ ಗುಡ್. ಜೀರ್ಣ ಆಗುತ್ತಾ, ಹೊಟ್ಟೆ ಉಬ್ರ ಇರುತ್ತಾ, ದಿಸ್ ಓನ್ಲಿ ಇನ್ 2 to 3 questions we can assess the Agni. And Upashaya Anupashaya, this is also very important. Some patient will come and tell you, ಮೇಡಮ್ ಎಣ್ಣೆ ಹಚ್ಬಿಟ್ರೆ ಸಿಕ್ಕಾಪಟ್ಟೆ ಜಾಸ್ತಿ ಆಗೋಗುತ್ತೆ ನೋವು, ಅದಕ್ಕೆ ನಾನು ಬಿಸಿ ನೀರು ಹಾಕಿದ್ರೆ ನನಗೆ ರಿಲೀಫ್ ಆಗುತ್ತೆ. So these are very minute points you have to catch. So Upashaya Anupashaya is very important. And finally, we should not forget Nidana, that is Ahara, simple Ahara and Vihara. In 2 to 3 simple questions, we have to understand this. So it will not take more than 5 to 10 minutes. So speak with the patient. Rather than seeing the reports, we have to interact with the patient. That is the main key for this treatment. Okay. So here we got to know how to diagnose. Okay. After this, like I will be dealing with some vyadis related to joints. As I have previously said, we have got so many vyadis which has been related to the joints. Sandhis, Sandhishula, Sandhigata Vata, Amavata, Vata Rakta, Asimajagata Vata, Prostipishesha, Gridrasi, Vishwachi, Apavahuka, etc. You are all well versed, I know, because always for Vyamachedika Nidana, you used to write all this, no? So, just in one table, I'll explain what is the Pratyatma Lakshana of each vyadi. So, this is important because, as I said, in OPD, you don't have so much time to refer the book in front of the patient. So, we have to quickly grasp one Pratyatma Lakshana of each and every vyadi. I know in every patient the Pratyatma Lakshana will not be there, but this will be easy, but more percentage of people will come with the Pratyatma Lakshana only. So just we'll go through that. In Sandhigata Vata, what is the Pratyatma Lakshana? That's Atopa, Shula, Karma, Hani. All of this I'm only stressing about Lakshana bit, but with this you should also correlate with the Nidana. That is very important. But sometimes the Lakshanas may be same as I've said before, but Nidana will be different and Samprapti will be different. Here I have put in just Pratyatma Lakshanas of these Sandhishulas. Okay. So next it is Amavata. Amavata, we all know that there will be Sarvadehika Ama Lakshanas, and along with that there will be Sandhi Vedana. Okay. Vatarakta. At same symptoms, if it is associated with Daha, Ragata, etc. Vatarakta. Gridrasi or Vishwachi, we all know that either in Kati or Manya Shula, that is with radiating pain, and Apavahuka, Sabdata and Ruja in Bahu. And Asimajagata Vata, here there is Samtata Ruja, this continuous pain will be there. The pain will be so severe that it also creates disturbance in our sleep. That is Aswapnata is the main factor here. And Prostipishesha, this is nowadays it's very difficult to get, but there will be cases like this. It only inclines to one joint, that is Janusanghi only. With Shofa, and it will be associated with Vata Shonitaja, and there will be Maharuja. Okay. After saying all this, now we have dealt through this Lakshanas of some of the Sandhis related vyadis. Then let's go to the Chikitsa point. How we have to understand this Chikitsa. Okay. Here, first thing what I'll be saying is, see, the basic concept of the Chikitsa is Asya Amashesthani Roga Nasta Shivavatan Uda Pakva Shestamsha Hantyashu Datramaushadam. This is from Charaka Chikitsa 38th chapter. Okay. Here we can consider even Shodhana as well as Shamana. If at all the dosha is present in Amashaya, from Asya we have to take the medicines, in Shiras, Nasya, Nasa, that is from nose, and Pakvashaya Guda. This also applies as we all are Panchakarma students, we know that Yathasanam Yathabalam. We have to, this will be applied to the Shodhana and this is for Shamana. The nearer roots we have to extract the doshas. Okay, this being the basic treatment concepts. Let's continue with the Panchakarma, that is with special reference to Panchakarma as I am speaking with the treatment aspects. So Panchakarma, we all know Panchakarma is mainly three. These are all comes under Panchakarma, that is Purva Karma, Pradhana Karma and Paschat Karma. In Purva Karma, Deepana, Pachana, Snehana, Svedana. Okay, in Pradhana Karma, it's Vamana, Virechana, Basti, Nasya Karma, Raktamoshana, we all know this. I will not go into detail. Okay, in Paschat Karma, it is Kavala, Gandusha, and Samsam Sarjana Kriya and Dhumrapana. And here the Paschat Karma varies according to whatever Pradhana Karma you have done, according to that the Paschat Karma varies. Okay, the Purva Karma also. So, come to the brief introduction, like in what avasthas we can include these Snehana and Svedana. Okay, in Snehana and Svedana, coming to this, in Vata Vyadis and Sandhishula conditions, Snehana and Svedana acts not only as Purva Karma but it also acts as Pradhana Karma. That is very important. In this Sandhishula conditions, Snehana Svedana not only Purva Karma but it acts as Pradhana Karma also. Okay, so coming to this way, Snehana, we all know it's Abhyantara Sneha, Bahya Sneha. Abhyantara Sneha includes Acha Sneha Pana and Shamanagara Sneha Pana, and Bahya Sneha, Abhyanga, Seka, Pichu, Kadapurna, Netratarpana, etc. Okay. Svedana, here is a gross classification of the Svedana. This is according to Acharya Sushruta. He has considered 4 types of Svedana, and in that only Charaka's 13 types of Svedana will come. Tapa Sveda, Vanaha, Rava Sveda and Ushna Sveda. Here is a chart, just go through this. Okay. Next one. Here mainly whenever we are considering with this Svedana, Sakni type of Svedana helps him a lot in these conditions, arthritis, brain predominant arthritis, except Pittaja and Raktanubandha. In Raktanubandha and Pittaja conditions, we have to go for Niragni type of Svedana. If at all Svedana is required, we have to go for Niragni type of Svedana. Okay. And Vamana. In what all cases we have to consider Vamana? We all know in Kapha Pitta condition predominantly, and whenever the sthana of doshas, whenever it is in Uras and Amashayas, we have to consider for Vamana. And whenever there is a Bahu dosha Lakshana, this we should not forget. Without Bahu dosha, we should not go for Shodhanas like Vamana and Virechana. And in Virechana, either it Pitta Kaphaja or Pitta Vata condition, whenever the dosha is in Adho Amashaya, and it also helps in Raktaja involvement also. Basti. See, here comes the main treatment principles of Sandhishula or Bhaktavya. It is highly effective in Tridoshas also. That's why it is called as Ardha Chikitsa, because we all know why Basti is called as Ardha Chikitsa. Since Vata is the culprit in almost all the diseases, Vata Dhrite Nasti Rojanu, hence to mitigate the Vata, Basti is the prime treatment, because Sthanam Vadasya Tatrapi Pakvadhanam Visheshatah, because Vata, which mainly resides in the Moolasana of Vata, is Pakvashaya. There is a commentary also stating that Atayeva Vaste Basti Pradhana Uktaha Basti Rupakrama Pradhana Uktaha Moola Apakarshana. For the Moola Apakarshana of Vata, Basti is said to be highly effective. Hence, it plays a very important role in Chikitsa, either Anuvasana Basti or Asapana Basti. Okay. Come to the Nasya. Nasya mainly in Urdhva Chaturvata. Here I have simply stating you the condition of diseases which can be treated with these Panchakarma. Later I will be dealing with a specific karma with a specific disease. Okay. Here Nasya Urdhva Vyadis, and it's helped a lot in Vataja and even Vata Kabja condition. The beauty of Nasya is with different dravyas, we can go for different combinations of doshas also. With permutation and combination of the dravyas, we can maintain tridosha also. That is the beauty of Nasya here. After this, Rakta Mokshana. Obviously, in Rakta Anubandhi Vyadis, either Sthanika or Sarvadaihika. We all know when it is Sthanika, we can go for Shanga, Alavu or Jalauka according to the doshas, or when it is Sarvadaihika, we can go for Silaveda. And it does wonders in pain management. So, in our practice, in OPD practice, Jalauka is a must because whenever there is an emergency, whenever the patient comes with a severe pain and he requires a sudden relief of the pain, that is associated with Daha, Ragata, etc., swelling in the joints, the Jalauka Charana does the wonders. It is a very, very good choice to keep a Jalauka in our clinic. Okay, we have dealt with all this. Here is some glimpse of what diseases as well as the treatment aspect. What we are forgetting now, what I have said, the cases. Now we should go back to the cases because we get to know some of the gist of the Vyadis as well as how to diagnose and some of the treatment principles, etc. Now we will consider these cases and we try to solve these cases. Coming to the case number 1. What are the key points here? The occupation is farmer, he is a male patient, and crepitous presence and the activities. The pain usually worsens during activities at the evening, that is Dina Ante. Please mute. Shall I continue? Yes, ma'am, you can continue. Please. Okay. Please mute all your audio. He's a farmer and on examination there was crepitus and the pain worsens during activities at the evening. That is Dinante. As we have said previous, according to the chart, Dinante, which dosha aggravates, that is Vata. And Nidana also, since he is a farmer, he used to do very hard work without any rest and with abhukta avastha, without taking any food, he used to work so that Vata aggravated. And here appetite also it tells because it is uncertain. Aniyamita Agni, whenever he says ಒಂದೊಂದು ಸತಿ ಹಸುವಾಗುತ್ತೆ ಒಂದೊಂದು ಸತಿ ಹಸುವಾಗಲ್ಲ. See, this is the Agni type. From this itself, we can consider that it's a clear case of Sandhigata Vata. Here, in this case, there was a Kevala Vata Samprapti. See, Dhatu Kshayajanya, because how we came to these conclusions, with history taking itself, we came to this conclusion along with the examination also. Okay, Dhatu Kshayajanya, that is Vata, increases in this case. So what we have to do? What we have done, the treatment. Okay. What we did is first I have selected, since this is a Kevala Vataja Vikara, first what I did was Matra Basti with Kshinabala Gantaila. Matra Basti helps a lot. It is usually indicated in Kevala Vataja Vikaras itself. But this one, I have given this in ascending order. This ascending pattern of Matra Basti is explained only in Brindhamadava. We all know ascending pattern of Sneha Kana, but it is rare to practice ascending order of giving the Snehas in Matra Basti. This is explained in Brindhamadava, as I said before. Here I have selected Avara Matra of this Matra Basti. He has given, according to him, there is classification, that is Avara, Madhyama and Uttama. We all know that Matra Basti is 1.5 pala, okay? And Avara Matra, it comes to 1.5 pala at the last day. You see here, first day there will be 24 ml. He has given 24 masha. Since masha is 1 gram, I have considered it as 1 ml approximately, okay? So given 24 ml and day by day increased by 8 ml. That is second day 32 ml of Shirvala Thaila was given, and third day 40 ml, fourth day 48 ml, likewise fifth day 56, 64, and last seventh day 72 ml. That was reached. 72 ml, it approximately comes as 1.5 pala. This was Abara Matra of this Matra Basi according to him. Why we have selected this is when giving this ascending pattern order of the thailas, it does fasten the absorption, because usually you have seen the cases we have, because whenever we administered the sneha, the first day only if we administered sneha in bahu quantity, in more quantity, there are chances that within 1 to 2 hours the sneha may come outside. So that should not be the case. Hence, to prevent that aspect, we have given slightly, we have increased the dosage from day to day so that the patient can become accustomed. So how much the sneha retains in Pakvashya, that much success we will get in treating Vata, because we are treating Vata in the Pakvashya here. So directly whenever we are giving the thaila, it will remain in Pakvashya. So how much time it remains in the Pakvashya, that much Vata Kshaya we can expect. Okay, so this is the main intention behind this ascending order of what Matra Basti, and this is in Avara Matra. We can also, according to the condition of the patient, even we can go for Madhyama or Uttama Matra also. See, Madhyama Matra, it starts with 4 pala and we have to increase by 1 pala. At last it will reach to 3 pala. Here, Madhyama and Uttama Matra we can give up to 9 days. But in Avara Matra, 7 days are enough. Okay? And Uttama Matra also 6 palas in total we get, and we should start with 2 pala and increase by half of pala daily, and we can continue it up to 9 days. Okay, so this is the first line of treatment what we have under the patient. The secondly, Sthanika Abhyanga and Svedana with Sindhuvara Thaila. Okay, for 1 week, and along with that simultaneously we also went for Tila Thaila Seka. Okay, since it is Kevala Vataja and warm Tila Thaila Seka, it helps in reducing the pain as well as does the Vata Shamana. Along with that, Shamanaushadhis were also given. That is Kshira Yamaka 2 to 8 teaspoons before food with milk, and Yogaraja Guru 2 days before food, and Sacharadikasha 15 ml with water before food. Okay, this was the case. Okay, this is a case what we have treated, and in the first sitting only has got 80% of relief, because the symptoms were not that much chronic. Only since 1 month or 3 months he was suffering. So this was easy to treat. So this is a treatment what we have given. Okay, this was the case. Other scenarios also may come to our practice. For example, we have seen Kevala Vataja. What if Kafanubandi Sangigata Vata, if it comes to our OPD, what we have to do in that case? That is, we have to really go for Upanahasveda. And here, there is no, you should not go for continuous Nihavasi. You should keep it in mind. Whenever there is Sangigata Vata, okay, we can give for Matravasti and Masamvasti continuously, that should not be there. But all it is with the Anubandha of Kapha, then we should not go for continuous Nihavasti. In between, we have to go for Niruhavasti, because if we use continuous Nihavasti, then there is a fear of Kapha increase. So for that, we have to go in between Niruhavasti and Dashamula, Rasnadi, etc. Vata Kaphara Kashayas, Niruhavastis we can go. Along with that, for local treatment, Upanahasveda is very good in Kapanuvali, Sangigata Vata. Upanahasveda, what is Upanaha? Okay, here indeed it is a very good methodology, which is as Priyadarshini ma'am said, I have done my thesis in this topic only, that is Sangigata Vata, Upanahasveda, and it gives tremendous results. Even now in my practice I am following this Upanahasveda, and it is giving a very good results now also, and this is even very, very cost effective. See, Upanahasveda is nothing but mainly Bandhana, Nahi Bandhana. maybe bandhana method is followed, and what are the dravyas, the general dravyas which we have to use is lavana, amla dravya, sneha, kinva. These are must in the Upanahar Sveda. Okay, along with that you can go for any combination of combinations. After this is according to the doshas. Okay, and particularly there are types for every anubandha of doshas. Like in Kevala Vataja also you can go for Pittanubandhi, Kaphanubandhi. Just we have to alter some of the formulations and we can go for Upanahar Sveda. Here in Kaphanubandhi Vata, Godhuma Adi Yoga, what I did in my thesis is very, very effective. That is, Godhuma Shakaleshturne Yavana Mamla Samhitaihi Sasneha Kinva Ravana Yupanaha Prashasyate. This is very simple. Along with these dravyas, that is lavana, amla dravya, sneha, etc., sneha dravya, we have to just mix it with equal parts of godhuma churna and yava churna. And along with that, a warm paste is done and it is applied on the knee joint. Along with that, bandhana should be done by using any vatahara patras, and after that we have to tie it with cloth. This is a very simple method and very effective method in Kaphanubandhi. Sandhigata Vata. Okay. So now, after completing this case number 1, we'll go for case number 2. What treatment we did for this? Okay. In case number 2, here main points what we have to consider is low back pain, radiating pain, and its numbness and tingling sensation, and it's also associated with heaviness in 3 months. Okay. And here the pain increases after rest. You have to keep this in mind. Morning and night while changing the postures. This implies a slight possibility of kapha anubandha is there in this disease. And no history of fall also. Okay. Then after history taking, what we have come across is the patient Gildanas like Ati Bhojana and Divaswapna. Since he has got no job, just ಊಟ ಮಾಡೋದು ಮಲಗೋದು ಸುಮ್ಮನೆ ಕಾಲ ಕಳೆಯೋದು ಅಷ್ಟೇ ಕೆಲಸ. So this was the history what we got so like with these complaints, and with the kapha is also present, we have diagnosed it as vata kaphaja gridrasi, not simple gridrasi, because even lakshanas like gaurava is present and kaphaja kala vedana buddhi was present with this. So finally it was diagnosed as vata kaphaja gridrasi. So what treatment we did for this? Since it was vata kaphaja gridrasi, pachana is a must. So we did pachana and anulomana, which would be amrita yamaka, 2 teaspoons before food, bleed with hot water. That is 2 days. And Vaitarana Basti for 2 days, and Kala Basti. Right after Vaitarana Basti, we have started with Kala Basti. That is with Vashamula Kashaya Basti and Anuvasana with Sacharali Taila. So total 16 Bastis were given. And along with that, simultaneously, Sthanika Pega and Patrapita Sveda, 16 days was given. Okay. Nextly, Kati Basti after Basti. See, this is a very important point. If the kapha association was more, then we should not go for directly Kati Basti. After pachana of kapha or Shesha Vata like Shamana, Kati Basti is very good. Because we usually think that whenever the patient comes with Kati Shula or Gridrasi, sudden thing which crosses our mind is Kati Basti. Kati Basti we have to write. Okay, this is not that much apt. We have to analyze the doshas, whether Vata dominance is more, Kapha dominance is more. If at all the Kapha dominance is more, we have to first go for Pachana. And we have to go for Pachana of Kapha or Kapha Shramana or Kapha we have to remove. After that, for remaining aspect of the Vyadi, we have to go for Kati Basti. And this was also done with Sindhuvara Taila for 15 days. Okay. Along with that, Shamana Aushadhis like Shanga Gugulu, Sacharadi Kashaya and Sindhuvara Taila for Sthanika Apurana and Sindhuvara was given. So this was a case with Vata Kaphaja Gridrasi. Okay. So in other scenarios, okay, Vaitarana Basti what we have given is very good Basti which helps the doshas move from Shaka to Koshta. From this, it removes the doshas from shakas, it brings to the kosta, and from kosta, it removes the ama or kapha dosha. So here we all know that Saidhava Lavana, what are the ingredients, main ingredients? Since it plays a very important role, I'm telling you this. Saidhava Lavana, usually one kasha, Buddha, Chincha, Gomutra and Pilataila is used. And we can do slight variations with this also, like with Gomutra we can also add some Kapahara Kashayas, Kapavatara Kashayas like Dashmula or Trifala even better. You can use it like that in Vaitaranamasi also. According to the condition, we can alter the ingredients, but not the quantity proportions. We have to keep that in mind. With keeping that in mind, we can add any ingredients according to the doshas. Okay. So this was Vatakapasha Grudrasi treatment. And next, when other scenarios, what happens if Kevala Vataja comes? Okay, we have treated Vatakapasha. In OPD, it came as Kevala Vataja. So here Matra Basli can be given with any Vatara Kaila, since it is Kevala Vataja. But before giving Matra Basli, we have to make sure that it is Kevala Vataja. Otherwise, we will not get that much success in the treatment. Okay, and after that we can go for Kati Basi or Kati Pichu. Kati Pichu is also very effective because the heat retention will be more in Kati Pichu, and it is very easy. Efficacy is there. Easy to do that Kati Pichu. In just OPD practice also we can do that. And Ushna Taila Seka. This is also gives very good results in Kevala Vataja Gridrasi. Okay, this was about case 2. So next. This is about case 3. Here the main symptoms were that is bilateral knee joint pain, and it was with Shofa since 1 year, and there was tenderness present and effusion was also present bilaterally, and please consider this pain increases in early morning and patient struggles to get up, and there was other sarvadehika lakshanas like reduced appetite, body pain that is agamarda, aruchi, etc. etc. So after talking with the patient, what history we got is Hetu, the patient was having Jwara 1 year back. See, this is always we miss this concept. In the previous past history and or past illness, we have to collect each and every past illnesses what the patient went through. Here she gives the history as she has been diagnosed as severe Jwara and it is diagnosed as viral fever. Okay. While after that, for that, she went for treatment and some antibiotics etc. were given, and the Jwara was subsided within 2 days. Okay, within 2 days she was not having Jwara, but that day onwards she suffered from loss of appetite. Loss of appetite, she suffered. The appetite was never good for her since 1 year after the Jwara. But despite of loss of appetite, what she did was she indulged in food intake. Okay, it's a very misnomer nowadays that we see the time. Okay, it is 8:30. I have to take the breakfast. Okay, it is 1:30. Okay, I have to do the lunch. It is a must. Okay, it is 8:30. So I have to do the dinner. See, this concept is been trending nowadays. Time ಸರಿಯಾಗಿ ಊಟ ಮಾಡಬೇಕು. Time ಸರಿಯಾಗಿ ತಿಂಡಿ ತಿನ್ನಬೇಕು. ಅಂದ್ರಷ್ಟೇ ನಮ್ಮ ಆರೋಗ್ಯ ಸರಿ. This is a very misconception. Without analyzing our
ಅಲ್ಲ ಆಯ್ತು ನಾನು ಲಾಗಿನ್ ಆಯ್ತು.
Hello.
hello.
Ma'am, continue.
Okay. Yeah. Okay, as I was telling, there was a Jwara and there was a sudden loss of appetite. After the loss of appetite also she continued in indulging of food. What happened there was, since the ama was there from jwara itself, the jwara was forcibly subsided, and that ama which has caused jwara, it went into lean avastha. And what happened further, she indulged in food, it increased the ama and it got lodged in the sandhi. So this is the samprapti what we got from the history. And even ama lakshanas were also present, so hence we diagnosed it as amavata. But here nidana is very specific, this we have to understand why she got amavata. So Amavata, which presents with the Sarvadehika Lakshanas also. So what we did was, firstly there was Amapachana, that is with Vaitarana Basti. Vaitarana Basti, it does wonders in Ama. Eh, According to the condition we can give, but not more than 3 days we should give continuously. Here we have given her 3 days continuously Vaitarana Basti. Usually Vaitarana Basti is also indicated even after taking food, that much Tikshna it is. But in this patient, so much ama was present that after giving 3 Vaitarana Bastis, she started getting relief. And after this Vaitarana Basti, we have started with Basti Karma. Okay. And Sukshma Avalokana of doshas were there. Since this was somewhat complicated case, there was association with Vata as well as Kapha. What happened was usually in these amavata cases, what happens, if you give niruha basti, the vata component will increase, if at all that is the dominance, that was in dominance in that stage. And in anuvasana basti, the kapha will increase. So we have to do the sukshma avalokana of doshas, and accordingly we have to change the pattern of the bastis, that we can do. And along with that, Nitya Anulomana was also done with Dashamula Katutrayadi Kashaya along with Nagaramrita Yamaka. So here, what was the main principle here in this patient is Ama Lakshana, Ama Pachana was done, and it is brought to the Kosta, and from Kosta that was removed. So this is not easy and this is not curable in one sitting. So, but after these also the patient got relief, 50% relief. She was able to walk and the swelling etc. was reduced, and she is still in follow-up now. Okay. So the main purpose of this was Ama Pachana. Okay. So this was a condition of Amavata. And along with that, what we did was Lepana also. Lepana with Kulatha. See, this was a mixture of contents like Kulatha, Koduma, Rasna, Nagara, and along with that Saindavara, Lavana. With warm water, warm Ushna Lepa was prepared and it was applied on both of her knee joint. With that, we got results on Shofa, that is swelling was reduced and patient also got relief from pain. And along with this, Shamanaushadis like Simhanada Gugulu, Dashmulat Katutra Kashaya with Nagaramrita Yamaka, 3 spoon BD before food was given. Okay, this was the third case. And what may be the other scenarios? Okay, this was the scenario and we have treated this case. What may be other scenarios of this aspect? That is, it can come with Pitta Anubandhi. Like instead of Graha, Stamba and Vedana, the patient can complain of Daha. Daha will be the main symptoms of the Tumba Uri and Ragata. Ragata of the joints along with the Shofa, there will be Ragata, Daha. In that condition, what we have to go is, firstly, we have to do Virechana. Virechana is the main line of treatment. Here we can go for Snehapana with Amrita Grita and Virechana with Amrita Eranda Talma. Okay? And if at all there is another scenario like severe Ruja and Daha, I have explained it previously in Rakta Mokshana. Whenever the cases comes with severe Ruja and Daha and Ragata etc. in the joints associated with Shofa, for emergency relief, that is for Atyeka Vedana Shamana, we can go for Jalokachana. It is a very, very, very good method to go for this type of condition, and it also gives patient a very fast relief. After that, we can go for other mainstream line of treatment, that is Rejana, etc., etc. Okay, and here in this type of avastha, we can also go for lepana, but here Shita lepana is preferred since it is a it is a pitta anubandhi vyadhi, like manjishta, lodha, yashti madhu with rose water, or otherwise even milk can also be used. Shita lepa is preferred. Okay, this was the case of Anuvada with pitta anubandhi. Okay, last and final case, that is, we'll see here. He was also a male patient and a businessman by profession. He came with a severe pain in elbow and wrist joints. Okay, and when asked about history, he was suffering, and he is also now suffering from psoriasis since 10 years. And the presentation was with tenderness, swelling, redness, and stiffness was present. And the pain pattern was like it used to suddenly increase and suddenly decreased unevenly, like there is no time aspect for that. Yeah, ಒಂದೊಂದು ಸತಿ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಒಂದೊಂದು ಸತಿ ಕಡಿಮೆ ಆಗುತ್ತೆ. It was the literally statement of the patient. Okay, like this, what we did, how we have to understand here. See, firstly we have to keep in mind that he is having history of psoriasis and he is still under allopathic treatment. At that time he was still under allopathic treatment since 10 years. Okay, since 10 years he was suffering from psoriasis and he was under allopathic treatment, but there was patches all over his body and it was extensively spread. But since 6 months, what he has started is he has started developing the joint pain, especially the upper joints like elbow joint pain and the wrist joints. And he is also a businessman by profession. What we have to understand is concept. Okay, what they have diagnosed is, he also came with the diagnosis, I told you. He also came with the diagnosis of diagnosed as psoriatic arthritis. Please give me treatment to this psoriatic arthritis. But after analyzing his case, how he has developed arthritis with the psoriasis, how we have to understand, that we'll see. See, what we all know, Kushta, it's a Bahya Roga Marga. Bahya Roga Marga, it is Vector also, Kushta is a Bahya Roga Marga. In this condition, what happened was, there was a Kapha Pitta dosha due to the Teachna Aushadas. What happened was, it got Paka. Paka happened, that Kapha Pitta Paka happened. But not that much to enter into the kostas, but what it happened is, it struck towards the Madhyama Roga Marga. See, doshas have this, we have to understand Marga of the doshas. Doshas have the tendency to change the margas, that is from Koshta to Shaka, otherwise from Shaka to Koshta also. We all know Vyayama, Vridhyat, Vishendanat, Pakat, Sotomka, Vishodhanat, that what happened from Shaka to Koshta. What happened here is, from Shaka, the Kapha and Pitta due to the Paka, it started traveling toward Koshta. But that Paka and Vriddhi was not, that Utvesha was not there. So what it happened is, it struck in Madhyama Roga Marga. What was Madhyama Roga Marga? Sandhi, Asti, Marmani. Due to the Kledaka, Kapha and all, it went towards Madhyama Roga Marga and lodged in the Sandhi. This is what happened. We all know that Madhyama Roga Marga diseases is Krichna Sadhya. Okay? This is what exactly happened in this case. And after lodging doshas in that Sandhis, he started to begin Sandhi Shula, Stabdata, Shofa, etc. So primarily, why every patient of Kushta doesn't develop psoriatic arthritis? Why always some patients only will be presenting with the symptoms of Sandhi Shula in the Twakvikara, because this is the case. Whenever what I was said before, whenever the primary Vyadhi,
Excuse me, ma'am.
please.
Sorry for the interruption again. Due to the network issues at the place of speaker, please stay tuned. It will start soon. It will restart soon.
Here it's raining heavily, so the network is not proper. Okay. So coming to the treatment aspect, what we did here is Jalaupracharana for subdue Shamana of Vedana, as I have said previously. And after that, we went for Virechana, that is Nehapana with Panchakarma Grada for 5 days, and Sarvanga Abhyanga and Sweda with Surasataya for 3 days. After this, Virechana was given with Manivadra Grada, that is 40 grams. Okay, this is a case of what we expect in this case. What we can learn from this case is what happened after treatment. These doshas which from Bahya and Madhyama Avastha, it went to the costa and it was removed through Virechana. Okay, and as I've already said previously, this is not possible in one sitting because it is very difficult. Since the Vyadhi is from 10 years and that primary Vyadhi has even to secondary Vyadhi, so we have to treat the Prathama, the primary Vyadhi also. So this was not possible in one sitting. This we have to convince patient. Patient convincing is also an art of OPD practice. We have to convince it. Okay, so after this also Shamanaushadis were given, that is Kaishora Guguru, Vasamritamaka, 10 ml BD after with hot water, as well as Manjishali Kasha, 15 ml BD after food was given. Okay, this was the cases. Okay, now what we can understand with this case, along with all these aspects of doshas, marga of doshas is also very important. What we usually forget in practice is we forget to consider the marga of doshas, whether it is abhyantara, madhyama marga, or abhyantara, or shaka, that is bahya marga. See, the conditions like what I have said is like amavata and post-viral arthritis, which is a very much trend. It's a very hot topic nowadays. It is post-viral arthritis, etc. It is nothing due to the change of marga of doshas. What is this? I have explained. Post-viral arthritis is nothing but patient. The presentation will be the patient will be presenting with Tishna Jwara. Jwara will be more. Whenever that patient goes to a clinic or hospital, the main importance was given to reduction of temperature. That is the mistake what we are doing now. For reducing the temperature, we are just suppressing the jwara. With that suppression of jwara, the ama which causes the jwara is also will get suppressed and it will get lean avastha into the dhatus. And it will be waiting for some opportunities. We all know Kriya Kala. With that, whenever there is Kavai Gunya, etc., or Ama, which is always usually, it is somewhat affinity with the Kapha. The presentation may be vary according to some patients. After Jwara, some patients may be experiencing the Shwasa. That is, it is also Kapasthana. So that time what happens is after Jwara, it gets lodged into the like Uras and it can cause Shwasa. And in most of the patients, it will cause Sandhi Shula or Sandhi complications like Amavata, etc. Because that Ama get lodged into the Sandhis after the mismanagement of Jwara. So this is a very important aspect what we have to keep this in mind. So Samprapti is very important. Samprapti, according to, along with the Lakshanas, Nidanas, etc., Samprapti, how that Vyadhi occurred is also very important. And it is always different to different types of person. Maybe the same Amavata, the 10 persons with same diagnosis as Amavata can present with different Sampraptis. So, this is where we come. This is where we Ayurveda physicians come. This is our beauty of Ayurveda. So, we have to develop these practical principles to adopt whenever treating a disease in our OPD. So what next? Okay, we have all dealt with the cases. We happen to know all this. Okay, Panchakarma is also over. After Panchakarma we have given to the patients who have come to us, Panchakarma is over. What we have to do next? Okay, we can send them. Okay, nimdu Panchakarma aitu, inmel ನೀವು ಚೆನ್ನಾಗಿರ್ತೀರಾ ಹೋಗಿ. Like this we have to do. What we have to do after this? See, here we get a very beautiful quotation in Charakas Chikitsa 30. It quotes as निवृत्तो अपि पुनर्व्याधिः स्वल्पेन आयाति हेतुना क्षीणे मार्गी कृते देहे शेषः सूक्ष्म इवानलहसि तस्मात् तम् अनुबध्नीयात् प्रयोगेण अनपायिना सिद्ध्यर्थं प्राप्रयुक्तस्य सिद्ध्यस्यापि औषधस्य तु. So what happens here? What it says is, even though the vyadhi is in nivrita avastha, vyadhi has completely cured. Okay, patient ಹೇಳ್ತಾರೆ no pain, no stiffness, okay, I can walk very freely, okay, patient will tell you like that, treatment ಸಾಕಲ್ವಾ ಪಂಚಕರ್ಮ ಎಲ್ಲ ಆಯ್ತು, and you will also get very happy, okay sir, treatment ಇಲ್ಲ, okay ಸಾಕು ಇನ್ನು ಸುಮ್ಮನೆ ಇದ್ಬಿಡಿ. No, we should not ever do that. Even also there is a nivrita avastha of vyadhi. The sharira will be so sukshma after this treatment is, it is very much due to the kshina and sukshmata of sharira, even the alpa hetu is also capable of causing the punarvyadhi avastha. That is, there are chances of vyadhi pradurbhava is very much more in these patients. In patients after nivrita avastha also. So this we have to keep in mind. Even though the vyadhi, what we think is vyadhi is in nivrita avastha, even though we have to continue the treatment. Hence the sharira should be protected with siddha aushadas. What is the importance of continuing the chikitsa even though it has been in nivrita avastha is to protect the sharira. Okay. So up to some extent we have to continue our chikitsas with the siddha aushadas. We have to keep. Here a beautiful simile is given, that is like a sukshma anila. How a very sukshma anala, that is a very peck of fire, will increase its ability with the little indhana. Likewise, with the alpa hetu flares up the roga as that of sukshma agni, flaring up with alpa nidhana. Okay, sukshma agni, ಈಗ ಬೂದಿ ಮುಚ್ಚಿದ ಕೆಂಡ ಇದ್ದಂಗೆ, will always say in colloquial language, will not see the agni there, but there will be a presence of sukshma anala in there. What happens? Well, even though there is a sukshma anala, if we put indhana, even small amount of indhana, then agni will flare up like that. After chikitsa also, after nivrita of disease also, we should not stop our treatment. We have to continue up to some extent. We have to make sure that the patient is baladhya enough to sustain in this world. After that only we have to stop the treatment. So this is one beautiful quotation which we have to always remember in our mind. Okay. So after this, likewise what I have said, I will be giving some details about whatever conditions, in what conditions we have to go for Panchakarma. This is up to point. Previously I have explained only avasthas. Now I will be telling in what vyadhis we can go for this Panchakarma chikitsa. This is just again, so I will go through. Please concentrate. See, in Vamana, that is in Amavata, after Amapachana, this is very must, because with Ama we can never do Panchakarmas. With Pachana only we can go for either Vamana, Virechana, Vastimasa, etc. Always we have to go for after Pachana. You know, we all know the consequences. Phalad Ama Rasaniva, the Sharira will begin to shrink if we go for these Shodhana Chikitsa, Vamana or Virechana, anything without Pachana or Kamadosha. So usually Vamana in Amavata, that there is Dhuri Pramana of dosha. That is after Amapachana we have to go. And in Virechana, Pitta Rakta and only Amavata or Vata Rakta. And in Basti, see, there is a beauty of Basti. It can be given in every Vata, Kapha, Pitta associated diseases. Vata Kapha Pradhana, Kridrasi Vata, Vata Rakta, Amavata, Sandhigata Vata. According to the condition, you can easily formulate your own Basti and you can give. Okay? And in Nasya, in Hanu, Manya, Sandhigata Vata, we can go for Nasya. what we say is temporomandibular joint disorders, TMD. In that case, Nasya, with the help of Karnapurna as well as Kavala and Gandusha, it does a wonder. Okay? And Rakta Mokshana, when associated with Daha, Ragata, and that's for immediate relief. This we have been gone through. Okay? Next is Snehana. Snehana, what type of Snehana we can use for? What type of? There is Abhyanga, we all know. All Vataja conditions, we can go for Abhyanga. Seka, usually a degenerative condition, that is Kevala Vataja, we can go. And Karnapurana, Manya Hanugraha, as I said before, with Nasya, Karnapurana and Kavala Gandusha, it helps very much in resolving the temporomandibular joint disorders. Okay, and Katibasi, Grivabasi, Janavasi is very common practice, and it is in Vata or Vata disorders where Vata has got a predominant function. Next, Svedana types. Let's go for Svedana type. There have got so many Svedana types, and in Jambira Pinda Sveda, usually we go for Igraha or Stabdata. That is, whenever there is an increasing kapha, we can go for Jambira Pinda Sveda. And Patra Pinda Sveda, for easy the mobility, that is, whenever there is a Vata predominant is somewhat more, then we can go for Patra Pinda Sveda with Vadahara Patras, etc. Chuna Pinda Sveda and Baluka Sveda mainly used for Rukshana, and Ama or whenever it is Kapha associated. Here, Chuna Pinda Sveda and Baluka Sveda is very important for Rukshana. That too, prior Manyastamba and Apabhavaka will be always associated with Kapha dosha, since it is Urdhva Chaturvata, like in Uras or above Uras condition. Whenever it is associated with that, Ruksha Purvaka Sneha should be done. In that cases, we can go for Valuka Sveda or Churnapinda Sveda. And Parisheka Sveda. In Amavata, we all know that Dhandyamla Dhara is very much indicated in Amavata for the relief of the symptoms as well as pain. And Nadi Sveda and Shula and Sambhapradana. So, we came to know about this gist of all this treatment according to the condition. And after this, we are finally coming to the conclusion. What are all the take-home points from this webinar? Since I have not dealt with any theory here, directly I have jumped on to the practical approach and how in OPD we have to consider the cases, how we have to understand those cases, and how we have to treat according to our understanding that we have done. So what are all some of the take-home points with that? Analyzing the Vyadhi in each person is a must, as I am saying repeatedly, even though it's the same Vyadhi. I have got the evidence also, we are all very, very well versed with this. Yoga Masam Triyo Vidya Tesha Kalopapaditam Purusham Purusham Vikshya Sadneyo Vishakutamahasi. This is a very much a basic principle of our Ayurveda. Ayurveda, that is Purusham Purusham Vikshya Sadneyo. When we will be called as Vishak Uttamaha, what a Uttama Vishak will do? Even though it's the same Vyadhi, the Purusham, it will be very different. So, first we have said, don't treat the disease, treat the patient. That is, analyzing each Purusha, we have to treat the disease. It doesn't matter whether it is Sandhigata Vata, Amavata, etc. Either in that same disease also, some persons it will be entirely different aspects, and with that the treatment approach will become entirely different. Okay. And another thing, don't fancy the name of the disease. See, what we all are doing now is, we will be coming through so much diseases nowadays, it's very difficult to remember also those diseases name. So, we should not fancy the name of the disease. Treat according to Trisutra, what I have said before, that is Hetu, Linga and Aushadha. This is the main basic Trisutra of the Chikitsa. If we able to crack this Hetu, Linga and Aushadhas in the patients, then we are able to analyze the disease as well as treat it accordingly. Okay. So, next point. Maintenance of Vata dosha is very important. Since there is no Rija without Vata, Vata Adrate, no Rija. So, and arthritis is a pain dominant disease. There is a Ruja in that. So, without Vata, there is no Ruja. So, we have to maintain the Vata dosha. First, we have to think about Vata. After tending to Vata, we can go for Anubandhi doshas and analyzing other factors like dosha marga, as I've said before. Sarvadahika Lakshanas also plays a very important role, etc. And by treating, knowing where not to go for Panchakarma is also equally important. So here in this 1 hour of time we have dealt with in whichever cases we can go for Panchakarma, etc., etc. But where not to go for Panchakarma is also very important to a physician. If at all very Alpamatra dosha was there, and as I have told before, Ama dosha was present in the patient, suddenly jumping into the Panchakarma will not yield any fruit. So this we have to keep it in our mind. Okay, these are all some of the take-home points from this webinar. And finally, I am concluding this. My favorite quotation, that is, Ayukama Yamanena Dharmartha Sukha Sadhanam Ayurvedopadesheshu Vidheya Paramadharasi. Every Purusha has a Chaturvida sadhana, that is Dharma, Artha, Sukha Sadhana. Sukha here refers to Dharma, Artha, Kama, Moksha. Okay, attain this either for us or for the patient, even for the patient. What we have to do is we have to be Vidheyaha and Paramadhara with the Ayurveda. See, what is Paramadhara here? Patha, Avabodhana, Anushtana. These three comes under Paramadhara. We have to read Ayurveda, we have to understand first Ayurveda, and Avabodhana, we have to educate others. What we are lacking nowadays is the common people, we are not reaching them effectively. Further, we have to give education about this Ayurveda. That is what Avabodhana comes. By doing this only, we can prevent further diseases, etc. Okay, Avabodhana is very important. Besides these two, that is Patha and Avabodhana, Anushtana is also very, very important. ಹೇಳೋದು ಆಚಾರ ತಿನ್ನೋದು ಬದನೆಕಾಯಿ ಆ ಥರ ಆಗಬಾರ್ದು ಯಾವತ್ತು. ಓಕೆ, ವಿಲ್ ರೀಡ್, ಓಕೆ ಪಾಠ, ವಿಲ್ ಅವಬೋಧನ, ಓಕೆ ವಿಲ್ ಟೀಚ್, ಬಟ್ we have to include Ayurveda in our life. That should be a main motto. Whenever we include Ayurveda in our life, then we can attain Dharma, Artha, Sukha for us also and for patients also. Whatever we are treating, whomever we are treating, those patients also will get Dharma, Artha, Sukha Sadhana by our Anushtana of these Ayurveda. So hence the tagline is believe in Ayurveda. Just believing in Ayurveda and including these Patha, Avabodhana and Anushtana, we can achieve any heights and we can understand any disease, and we have to analyze and we can give treatment according to that. So this will be my topic of today. So I will be concluding this. If you are having any doubts or any question, you can ask me. Okay?
Thank you, ma'am. Ma'am, we have some questions to ask. Shall we start?
Okay. Yeah, you can start.
Ma'am, there is a reference of Shara Vaitarna Basti and Shira Vaitarna Basti. In which condition we will give this to?
See, Amavata, whenever it is, I have said before, no, Amavata, whenever it is accompanied by Pitta, okay? Whenever Amavata is accompanied by Pitta, Anubandhi is more. Whenever the patient comes with Daha and Raga of the joints, we can go for Vaitarna Basti and Shira. There is some controversies, that is, instead of Shara, he may have given Shira also, that we will not discuss here. But we can give Shira in spite of that Go-Mudra in Vaitarna Basti, in Amavata, which is related with Pitta, and Pitta Vanda is more. Okay?
Ma'am, one more question.
Okay.
Ma'am, symptoms of fibromyalgia is similar to Amavata. Whether we compare these two?
See, what I have told before, comparing it does not yield any results, okay? That will be what I have said. Comparison, we should not do any comparison. Should not do Allah, but Fibromyalgia, okay, symptoms it will correlate with the ama, but you have to go for hetu. What may be the hetu, nidana and samprapti. Fibromyalgia may be different in different types of cases. Okay, not fibromyalgia also is a very varying disease. It will present itself with different symptoms in different persons. First we have to analyze that. After that analysis only we can understand that. Okay.
Ma'am, how to differentiate Pravruta Amavata and Pravruta Vata Rekta?
Pardon?
Ma'am, how to differentiate Pravruta Amavata and Pravruta Vata Rekta patients?
Same, go for Samprapti. What happens in the Samprapti there? Vata Rakta, there will be simultaneous increase of Vata as well as Shomita also. And the Lakshanas also will be same. And in Amavata, go for that Samprapti. There will be presence of Ama. Okay. And in my opinion, we can treat both in single and if Amavata, if at all, there is a involvement of Raktaja and Pittaja involvement, then Vatarakta treatment is also very apt for that. So, the disease name should not come here. Just go for Samprapti, how it happened, what all the doshas are involved there, how it happened, which doshas increase, and whatever lakshanas a patient is presenting with. And Nidana here, mainly differentiating factor is Nidana. Whether it is a Ama Pradushita Nidana was there in the patient, whether it was Rakta Pradushita Nidana was there in the patient. That you have to understand. Okay, with that understanding only you can differentiate and treat the cases. Okay.
Thank you, ma'am.
Okay.
One more question. Ma'am, in arthritis, whether we can consider Vamana? If we can consider in what stage we should consider?
I have said no previously. See, here it is in the slide itself. In Vamana, we can consider in the Amavata Lakshana. In Amavata, no. Amavata, when Ama is more or Kapha Pradhana is more, after Amapachana, we have to go for Vamana. If at all it is necessary, if there is a Bhuri dosha only, we have to go for Vamana. Otherwise, Vamana is not required. In Amavata condition also, after Amapachana only, we have to go for Ama. Otherwise, it will create complications. So, in arthritis also we can give, but according to the condition, doshas, if Kapha Prabhuta is there, and if at all Vamana is required, so we can go for that. Otherwise, there is no need. Okay.
Thank you, ma'am.
Okay.
Ma'am, one more question.
Yes.
Ma'am, is there any specificity in giving Arohana Krama Mantra Basti in Nandigata Varta? We can give Mantra Basti in constant dose also, ma'am.
Constant dose also we can give, okay, but what is the advantage of giving this Arohana Mantra is, as I have already explained, this Arohana Mantra helps in the absorption of Basti very much. So we have done many research also. Here, see the Sneha Basti type here, usually what we do is in 72 ml is the Mantra Basti dosage which we are getting in the Shastras, no? But what here it explains is Vrinda Mandava, whenever we go for ascending level, that is Arohana Mantra of Mantra Basti, the retention period will be more. Usually what happens, if we give 72 ml or that Matra of Mantra Basti in the first day itself, usually see the patient has not got any accustomed to that. So what he will do is that absorption will not take place and expulsion will be more, Matra Basti. So to avoid this condition and to remain the Taila or whatever Sneha we have given in the Pakvashaya for more time, so this Arohana Krama of Matra Basti is very much acted. And this we are not at all using in our clinical practice, but we should use this. Whenever the patient comes with this Kevala Vataja Samprapti, giving Arohana Mantra helps to retain Sneha in Pakvashaya a lot. Okay, so this is the advantage of the Matra Basti. The principle, the mode of action, etc. remains the same. But here we got one benefit that absorption capacity will be more if we give in Arohana Matra of Arohana Krama of Sneha. Okay.
Okay, ma'am.
Okay.
Ma'am, how to differentiate Avarana-janya Sandhigata Vata and Dhatu-Kshatrina Sandhigata Vata?
Okay. See, this is the topic. I think Dr. Kishore sir has covered this topic in previous webinar. But in Sandhigata Vata, I will tell. See, what Avarana-janya Samprapti it does is, I will show you with what Avarana does is, it does kapha or pitta. When it does the avarana of vata in the sandhis, then it will be due to the margavarodhajanya sandhigata vata. Okay. So this is a slide which explains it a lot. This is a normal gati of vata which is going. Whenever there is a marga varana, either by kapha or pitta dosha, there will be a karma hani. See, vata will be obstructed here due to this. Whenever there is obstruction of vata, there will be like increase of vata inside. You all know that by the concept of avarana. Up to some extent, it can sustain, but after that, the marga varnajanya vata vyadi will come to a picture. Okay, so in this case what happens is there will be medo and mamsa dhatu vritti. Usually it is seen in a staulya patient due to the medas or mamsa dhatu vritti, avarana of medas or kapha to the further portion of asti dhatu happened, and this will leads to the asti dhatu kshaya, leading to the degenerative cases in the sandhi. Okay, are you getting now?
Yes, ma'am.
So this is the main aspect. The patient will come with the same symptoms, but the samprapti is very much different and will not get any result by applying simple snehana svedana on this. Here we have to focus on to remove the avarana of Vedas, and associated with that we have to treat the underlying vata dosha. Okay, here we have to first go for virechana or lekana basti for marga, for removing that marga avarodha, either kapha, Vedas, etc. After this we have to go for this. Okay.
Ma'am, in many patients, we saw that effusion will be present in both osteoarthritis and rheumatoid arthritis. How to differentiate those, and what will be the pathology present, and how the treatment approach what should be there in respective cases?
See. Simple effusion of a joint. It is not a diagnostic criteria to either diagnose it as Sandhigata vata, that is what you call as osteoarthritis, or rheumatoid arthritis. Is it? Because to diagnose a disease, there are other so many aspects. What are all the Sarvadayika Lakshanas? Along with that, effusion also. In effusion also we can differentiate. That is Vata Purna Dhruti Sparsha is mainly present in Vata Jana. That is Sandhigata vata. There is no inflammatory fluid accumulation and it will be very soft. And whether in Amavata associated with that, there will be increase in temperature. This is a very key point. Well, if at all there is increase in the temperature associated with tenderness and all, then it is usually associated with rheumatoid arthritis. And other than this, what I have said, this single entity is not a diagnostic criteria. Keep this in mind. You have to find out the Nidana, Samprapti, as well as what I have stressed, Sarvadayika Lakshana. This is very important. With this only you can come to the diagnosis, and after that you can easily go for treatment. Okay?
Thank you, ma'am. Ma'am, one more question. Up to what extent calcium supplements helps in Sandhigata Vata?
Okay. Why you'll be giving calcium supplements? Okay.
Dhatukshaya conditions, ma'am. When
And
osteoporosis.
Hello, pardon?
In Dhatukshaya conditions, ma'am.
Okay.
Osteoporosis.
The osteoporosis, Dhatukshaya, calcium. See, we have to here imply Samanya Vishesha Nyaya is very much important. Giving simply calcium supplements will not yield any fruit in your treatment. This is a very here lies a flaw in the treatment. With the Dhatu Kshaya, we have to go for Brahmana. There are so many methods of Brahmana in our Ayurvedic aspects also. Not only calcium supplements doesn't help much. So I don't usually prefer calcium supplements. Rather than that, I'll give more concentration on how Brahmana is done on the Kshaya. Or Tikta Grita you can give, because Astik Kshaya is mentioned. Dhatu Kshaya is not directly like degeneration of this thing. In Astik Kshaya also, you can go for Tikta Grita as it is mentioned in our sciences. So I usually don't prefer giving calcium supplements. Okay.
Mukta, we will prescribe, no, ma'am, in that.
Yeah, that you can prescribe, but why? If at all it is present with Pittaja Anubandhi, you can go for Mutta Shuddhi. Okay, because it is mainly Pittahara. There is. Are you getting?
Yeah, ma'am.
Along with that, we have to do. So mainly focus on. See what basic aspects you just focus. Don't go for such a big aspect. Okay, osteoporosis, there is a degeneration. We have to impart that. Just go for basics. What I have told you today. Just go for what may be the cause. What are the lakshanas? If Kshaya is there, you have to go for Vriddhi. If Vriddhi is there, we have to go for Kshaya. Accordingly, you have to select the dravyas. If you do this in all, if we do this in all our cases, then analyzing the disease and treatment according to that will be very easy. Okay? Yeah.
Thank you, ma'am.
Over.
Thank you for giving such a wonderful presentation, ma'am. We had a lot of doubts. It also got cleared.
Okay.
Thank you once again, ma'am.
Okay, thank you. Welcome.
Now I invite Dr. Shaila, ma'am, Associate Professor, Department of Panchakarma, for vote of thanks.
Hello. Am I audible?
Yes,
Yes,
Hello?
ma'am. Yes, ma'am, audible.
I am unable to open this video. Okay, that's it. No problem. Namaste all. Okay.
Network problem is there.
Hello.
Ma'am, it's audible, ma'am.
Sorry for the network issue. It seems I think everybody has got rushed to move. So without delaying much of time, first of all, I thank Dr. Rajani for accepting our invitation and for her elaborate, effective, and very practical, oriented presentation. Thank you, Rajani. With this, many times I told we all remember your batch. All are very unitedly worked hardly in your batch. In your PC also we are very best batch, wonderful batch of all batch we come across. So for that is the sake, I think many of you have got government job as well, and Dr. Ashwini also come back to our department. So it's a very happy news for us, and even Dr. Shakuntala also joined, and many others also got jobs, and others also very successfully